I'm pleased to introduce our third presenter today, Abner Poon, who will be presenting our third and final session for third and final presentation for today's session on overcoming access barriers. And Abner will be speaking about a young carers project and young carers support-seeking behaviours. And after Abner's presentation, we'll hopefully have a little bit of extra time for some questions and answers, and we'll pass it back to me. So over to you. Thanks, Abner.
Thanks, Sarah. First of all, I'd like to acknowledge the traditional owners of this land, to the First Nation people, and also pay my respect to the elders past, present, and emerging. And of course, I'm joining this conference from the land of the Dura people. So I'm talking about challenges and support-seeking behavior of young carers. So in this study, there are a few of us. I just need to mention them first. We have Isaac, Endo, Jenna Aguila, Lucas, and Sarah from Carers New South Wales. So it's really a joint project by a few of us, and this project is led by Carers New South Wales. And I also want to acknowledge the young carer participants who contributed to the interviews, to the focus group discussion, and also other key stakeholders, and also the project advisory group. And last of all, I also want to thank DCJ for the funding for Carers New South Wales for this project. Next slide, please. Right, so this is the background of this topic. According to the ABS survey in Australia, 7% of carers are below 25 years old. So you might think that 7% is a small percentage, but you look at New South Wales alone, we have 83,700 young carers who are caring for people with disability, with aging, health issues, mental health problems, and also different things. And about 14% of these young carers are primary carers for family members. So they provide the most care, the most concern, and take on the most responsibility for the care recipients. So my main research is really looking at caregivers of people with mental health issues. And from this literature on caregiving, most of the studies actually look at caregivers of people who are older, and most of the caregivers are older in nature. So we know from the literature that a lot of caregivers experience caregiving impact, burden, psychological distress, and other sorts of things. So that is quite established in the literature. But regarding young carers, there are really limited studies concerning young carers in Australia. And you can see from the references here, most of these studies are so there are only a handful of studies that are done in the recent years. Next slide, please. So what do we know about young carers? So from the limited studies, we know that young carers often do not access formal services. So they don't identify themselves as as carers. And because of that, often they are missed out from the services. Even if they say that they are a caregiver of somebody, oftentimes services, health professionals, and social service providers, all sorts of different people, usually do not recognize young people as caregivers. So because of that, we know very little about young carers. We don't really have much research about young carers. Next slide, please. So sorry for the busy slide. So this study is part of the Carers New South Wales 2020 National Carer Survey led by Sarah. So it's a subcomponent of the study. So we have a group of people to advise on the project, researchers from different universities, staff of Carers New South Wales, and young carers. So people come together and discuss about the project, discuss about the questions that we want to ask the young carers, and how do we recruit young carers. Because we know from a lot of different surveys, interviews, research studies, often young carers are hard to be recruited for studies based on several issues. So we use a lot of ways to recruit caregivers, like using recruitment flyers. We try to be innovative, and we also send out the flyers to universities and also to the project advisory group. And of course, we also use snowball sampling as well. So in total, we recruited 25 young people for face-to-face interview, and 3 participated in focus group. So we have 28 young carers between the 16 to 26 years old. So Lucas and Sienna did the telephone and video conference interview and the focus group. So the interview schedule captured a lot of different things: the caregiving relationship, the support needs, the coping strategies, educational services, how to reach out and support caregivers. And the data was analyzed by Sarah, Isaac, and a few of us looking at the data several times. So we generated a few themes and subheadings, and we look at the responses. And the study was approved by Macquarie University, led by Lucas. Next slide, please. So first of all, I'll just talk about the social demographic factors of the young people. So most of them were female. So around half of the young people, they are from a culturally linguistic diverse background. So which is quite interesting. We know that most studies, caregiving studies, would miss out on people from a culturally linguistic diverse, but in this study, we capture around 50% of them from culturally linguistic diverse background, and 3 of them with First Nation background, and the average age is 22 years old. Next slide, please. So we look at the qualitative data and we analyze them, and we found 2 main themes. One is the effect of caregiving role, the other one on support-seeking behaviors. And for the first one, we have 4 sub-themes, and for the second theme, we have 2 sub-themes, which I will go through more in the next few slides. Next slide, please. So regarding the first one, the effect on caregiving. First of all, we discovered that these young carers, they actually develop maturity, develop life skills that will help them in different circumstances, whether it's in interaction with other friends, interaction with family members, interaction with service providers. So they develop a lot of life skills, even managing their schoolwork, managing their time, managing their work roles and different things. They develop a lot of life skills. This is pretty unique because most of the caregiving literature focus on adult carers. So therefore, we see a lot of negative impact. We seldom see a lot of positive things coming out from literature. But from this study, we see that young people do develop important life skills that will help them in different aspects of their life. Next slide, please. So the second sub-theme is that so young people develop self-efficacy and the formation of stronger family bonds with the care recipients. So they develop confidence, they develop life skills, they are stronger resilience to encounter to different challenges in life. And as you can see from the quote here, so much lived experience as a carer and with exposure to different conditions. I'm really excited for my future career, and it's really set me up with a lot of skills. The second thing is to develop emotional bonds, to strengthen the relationship with the care recipients. As you can see from this theme from Anna, who's 16 years old. Next slide, please. So the third sub-theme is effect on performance at school and work. So it is quite clear from literature on adults is that caregivers experience severe impact, on work, employment, income, also different areas. But for young people, there are 2 main things that come out from this study. The first is the limited ability to find work. So because of caregiving responsibility, so they have to give up work, or they have to cut short their hours. And several of these young people mentioned that because of that, there's an impact on the future job prospect. So it's not just now, but also in the future. The second thing is that because of a caregiving role and responsibility, oftentimes they have to be absent from school. They have to they have difficulty handing up their assignments. They have poor concentration, and that has a huge impact on them, on their schoolwork, as well as on their mental health, their well-being. So they often worry about the care recipients, even though they might be in school or they might be at work. So, and what come out from this is also that because the young people has been caring for the care recipient for a period of time. One of them mentioned they do experience burnout, which is quite common in the adult literature, but it's also coming out in this study on young carers. Next slide, please. So the effect on socialization. So one of them say that they will cut down on social activities so that they can be at home to care for the care recipients. They cut down on other social outings so that they can be at home to look after their loved one. So they do cancel quite a fair bit of things in order to cope with the responsibilities. As you can see from this quote here, there's been times where I say yes to going out to social outings, but then I have to cancel at the last minute because mom required my care. But at the same time, because of young people developing skills, life skills to cope with the caregiving responsibility, so they try to manage their time. For example, they might invite their friends to come over to their place for social interaction. At the same time, the young people can be at home to look after the relative with illness or other kind of issues. So they try to manage their time. They try to maximize all the life skills to cope with this role. And several young people mentioned that they actually maintain their friendship over the years, so which is pretty good about this. Next slide, please. So next, I will talk about the support-seeking behaviors of young people. First, coming out quite clear is that a lot of young people, they do not make use of formal community-based or healthcare services or other kind of professional support services. I will talk a bit more about this, but usually they will not access formal services. But at the same time, they will try to access support from educational institutes like in universities, schools, and they do make use of social media support like Facebook, online forum discussions, which is interesting from previous speaker mentioned that old people sometimes have difficulties and we can assume old people to understand about how to use certain functions in IT. But for young people, they do access social media support. They do make use of a social media support to get resources, get information and different things. Next slide, please. So next, I will talk about the factors affecting the support-seeking behaviors. I have categorized these numerous factors into three main areas. The first one is on perception, second one on services, the next one is on identity as young carers. So regarding the first one, perception, the fear of stigma associated with the caring role. So stigma has been mentioned several times in literature, also in this conference as well. So for the young people, they also associate the caring role with stigma because they're caring for someone. So oftentimes they will hide this information. They may not share with their friends, but for those who are closer to them, they might share about this thing that they need to look after, the person that need to look after at home. The next regarding perception is that a lot of them say that they face age-specific expectation from others. So for example, if you tell someone, I'm caring for my mom, I'm caring for my dad, someone will say, the teacher will say that, actually you are a child, don't worry about that. So they will actually be put down. And because of this expectation, they affect them in seeking help from services. Next slide, please. So the second one is regarding services. So a lot of young people say that a lot of services were not age appropriate in terms of caregiving support services. So a lot of caregiving support services, they would design services or, for example, support groups. And oftentimes, most of the members who attend support groups, they're older caregivers. And sometimes young givers feel that they are not provided with necessary support from services. The second thing is that the young people mentioned that services were not culturally relevant, not responsive. This is interesting because 50% of the young people in our study, they're from a culturally linguistic diverse community. So they actually mentioned about that. But at the same time, we know that young people, they know how to access services, and they also they often speak English well. So, but still, we see that young people say that services are not responsive to address the needs, usually regarding the care recipient from a different cultural background. And services were not responsive also to different stages of caring. For example, services might be more supportive of maybe younger people, younger carers, young children. But when the young carers grow up, then sometimes they don't feel that they are much supported. Next slide, please. Yeah, sure, thanks. So the next thing, as what mentioned by in a panel by Tracy, she mentioned that sometimes because young people don't take on the identity as a carer, sometimes they will not seek services and they will miss out on services. Even for those who feel that they are they're carers, they understand about this identity, but they do not seek formal services as well. And a lot of young people mention that this is part of the family responsibility to care for someone, and they are not really a carer. And because of that, next slide, please. So they have difficulty identifying themselves, and because of that, they miss out on available family support. Next slide, please. Yes, thank you. Yes. So I just go straight to the blue screen because of the time. Yeah. So there's some things that we are thinking based on this study. First of all, we need to recognize the strengths of young people. You know, the young people develop life skills, they develop positive things out of that. And service providers need to consider that and try to empower young people using a strength approach to involve young people, give them information, and get them in a decision-making process. And of course, we need to consider long-term effects of caregivers as well. So we know that caregivers experience impact, psychological distress, and different issues. So we need to consider that for young people, especially on education and work and socializations. And we need to think of new ways to help young people aware of their role and also to support young people. And of course, taking a whole family approach. Where service providers are looking after care recipients, we also need to consider the needs of young people as well. Right. Then Sarah, running out of time, I'll pass it back to you.